This week on Healthline, a hard look at the future of the Hennepin County Medical Center, and UCare may actually pay all of its bills eventually. Welcome to Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson. There's a lot going on at Hennepin County Medical Center. The county dissolved its governing board last year, and two new interim leaders are at the helm. A proposal to divert the county's ballpark tax to healthcare got floated last legislative session, but failed to advance. Dr. Kevin Croston, former CEO at North Memorial Healthcare, is now a co-administrator and told WCCO Radio this week that HCMC as we know it can't continue. He said the hospital's financial situation is critical and that clinics may need to spin off, services close, and it may even need a new ownership structure. Croston suggested possibly a relationship with a payer like Regions Hospital has with Health Partners, or a consolidation with North Memorial, or both.
I think in the end, Hennepin County Medical Center needs to be a part of something bigger. And if that would be North, great. If it's something else, great. And then I think that bigger entity needs to belong to an insurance company or align with an insurance company so that, again, the financial incentives can be worked out and you can share information and create a seamless pathway forward.
Hennepin County Commissioner Jeff Lundy also told WCCO Radio that without significant new revenue, like increasing the existing ballpark tax to 1% and diverting the proceeds to HCMC, shutting the doors is a real possibility.
Closure of the hospital is absolutely increases the chances if we don't get that sales tax. If we get the sales tax, we can make things work.
Lundy told Twin Cities Business that patients would be shifted to other hospitals if HCMC had to close or pare back, and some services, like burn treatments, might not be available to patients statewide. Lundy said nearly a third of HCMC's patients already come from outside Hennepin County. The legislature, by the way, convenes on Tuesday. Hennepin Healthcare also made headlines this week, announcing that it was taking nearly 20% of its beds offline, pausing retirement contributions to some workers, and putting $24 million worth of capital projects on hold. The Star Tribune reported this morning that the changes will also halt most transfers of patients to HCMC from outside of Hennepin County. Hennepin Healthcare officials say they have to close a $50 million budget gap by the end of March. And, of course, immigration enforcement was in the headlines again this week. Border czar Tom Homan was in Minneapolis on Thursday and announced that Operation Metro Surge had been a success and would also subside.
A small footprint of personnel will remain for a period of time to close out and transition full command and control back to the field office.
The surge has been cited as a potential reason for a reported drop in demand for both routine and emergent health care in Minnesota. Homan specifically addressed the presence of federal agents in Minnesota hospitals.
But as far as those stories about ICE going into churches and arresting people in hospitals, it simply has not happened. And if you have a case where it happened, you let me know. Because all the digging I've done there, I can't find a single one.
Homan did add, however, that no location would be off limits and repeated a vow that the Trump administration would continue to seek mass deportation of immigrants subject to removal. Also this week, a surprising development in the wind down at UCare, the nonprofit insurer that covered 500,000 Minnesotans and shut down in December. Providers feared that hundreds of millions of dollars in reimbursements would go unpaid, but a new court filing related to the company's unwinding has some potentially good news for providers. Abby Mochtig has more.
Financial documents filed in state court in St. Paul indicate that UCare's wind down may be more successful than many had feared. The Star Tribune reported that the insurer expects to pay the $900 million it owes to hospitals and may have more than $80 million left over when its court-sanctioned rehabilitation winds down in 2028. The Minnesota Department of Health took over UCare's operations in December after the insurer lost more than $500 million in the last 2 years. Last year, UCare had nearly 150,000 people enrolled in Medicare Advantage plans and handled coverage for about 400,000 Medicaid beneficiaries.
That's Abby Mochtig. Finally, the ongoing conflict over social service and health funding between Minnesota and the federal government ratcheted up a little more this week. The Minnesota Department of Health announced the Federal Centers for Disease Control and Prevention had actually canceled a $250,000 payment Wednesday, part of $38 million in public health funding the Trump administration threatened to take back. A judge's order late Thursday rolled back the cut, at least temporarily. MDH said that 107 health departments across 50 states got the Public Health Infrastructure Grant money starting in 2022 and set to run through 2027. Only Minnesota, California, Colorado, and Illinois are losing the funding. The Trump administration said the funds no longer reflect agency priorities. MDH Commissioner Brooke Cunningham called it, quote, retribution in a press release. The funds in Minnesota support nearly 60 state workers that track diseases and plan emergency responses. The funds also support nurses and workers across 200 local public health agencies, according to the Star Tribune. That's it for this week from Healthline, the weekly news podcast from the Minnesota Hospital Association. Thanks for listening.